Broadcasting from Silicon Valley, California, this is Conversations with Jennylyn.
You're watching Conversations with Jennylyn as I continue with my COVID-19 World Interview Series. I am taking us to London right now, and we are speaking with Dr. Shohreh Beski. Did I pronounce your first name correctly?
Shohreh Beski.
Right. And I thank you so much. I know you're a busy doctor, and you took time out of your busy schedule to spend this time with me and my viewers. And I'm very grateful because I keep getting questions from people telling me, get a doctor and ask her this question, ask her that question about COVID-19. But I don't want to launch into that as yet. I'd like to ask you just to share a little bit about yourself, your specialty, what you do in London, and then we will get to COVID-19 eventually.
Yes, no problem. First of all, I'm not world expert in COVID-19 at all. What I can give you information is mainly about obstetrics and gynecology and what is happening in our hospital rather than sort of a general overview what's happening in England. Yeah?
Yes.
So, personal first-hand would be. I am a obstetrician gynecologist. I'm originally from Iran. I have immigrated or came to England around 84 and continued studying here. I actually specialized in obstetrics and gynecology in England.
Okay.
A general, like a family practitioner in Iran, but I came here and specialized and got a job as a consultant, which is a specialist who works at NHS, National Health Service, and also private. I mainly worked obstetrics and gynecology until a couple of years ago when I changed. I stopped practicing obstetrics, private and NHS. When you reach 60, then generally you would not do any more of those sort of difficult obstetrics on call. So I'm doing now gynecology, and my special interest now is mainly to look at the neck of the womb and the vulva and vagina. So it's a new hobby I've produced, with the people who have got problem with the vaginal and vulval dystrophy, which is a name for abnormality of the skin of the genitalia.
Well,
okay.
I'm sure the men will find this part of the interview very interesting.
Sorry, but this is my job.
They're like, what do we want to hear about your vaginas? But I know that's great. I didn't even know that there was a specialty now for that. Is that new?
Sort of new, but because there was nothing up to recently to be done about these vulval dystrophies, so we didn't do anything, only cream, treatment, steroid cream, nothing we could do about it. We just monitor them in order not to get cancer.
Yeah.
Now, a little bit more like mesenchymal cell and stem cell, which you produce and we inject from your own body to that area, then those diseases are much, we think, although it's really, really in the very, very early stages. We have done only 25 patients, not in England. So it is not well known, but we are trying to get data.
So what causes that? What causes that to happen to the vagina?
Autoimmune disease. Have you heard of autoimmune disease? Autoimmune disease is the disease that your own cells produce antibody against your own cells. So some people produce antibody against the thyroid, then they may have thyroiditis. They may produce against their knees, for example, rheumatoid arthritis. Yeah? If you produce against the vulval area, that's called vulval dystrophy or lichen sclerosis or lichen simplex. These are the diseases nobody talked about, the lichen sclerosis, because it's a private part and everybody is a little bit, taboo and don't want to say that I have had itching for many years, I have had pain, I couldn't have sexual intercourse. this is now is coming out, and now we can see that there may be treatment. I say maybe because we don't know. It's not long-term outcome of these 25 patients. And also some laser treatment also cause some benefit towards some patients. So now the patients are coming with these problems and they are not worried, they are not embarrassed to talk about it. That's why we say to them, I'm sorry, there is no evidence long term, but it's not going to harm you. So we are trying and we're doing our best and we keep an audit. And if it works, good. At least there is something for them to do, you know?
Is this a form of cancer or no?
It's only when antibody attacks your own cells, if it goes into the lung, for example, really bad cause, and may cause death because the lung cells of the lung would be damaged. In the vulval area, it causes lichen sclerosis, and the cells are gone, the labia minora disappears, sorry, it's a little bit, you can get rid of these later. Clitoral hood would disappear. It will be all like if you look at a woman, you may think that is a prepubertal girl, but it's not. It's actually a woman, but because everything is gone and the actual entrance would be so small, that looks like a peripubertal girl.
Wow.
Who was 24 and from the age of 11 had this problem, and she was on methotrexate, which is is a chemotherapy drug, and only that could have controlled her symptoms of pain, discomfort, and pain during urination, everything, you know, and itching, constant itching. And we did this about 8 months ago, and she's now 10 months, no chemotherapy. And she's much, much better. But this is only one, and you cannot really say that this is amazing for her. I couldn't say it's going to be amazing for everybody.
So this is brand new. This is a brand new treatment that you're experimenting.
Not evidence-based.
Wow.
But only evidence, as far as I'm concerned, to these 25 patients, which 15% failure rate, which it doesn't work. But there are 85% that they get better to some extent. So anyway, this is my now hobby.
Well, that is great. But before that, you delivered babies and you were a regular gynecologist?
Yes, I was a obstetrician gynecologist, and yes, I was a consultant. I didn't really deliver that much straightforward. We supervised the trainees. Yeah, I'm sort of pretty senior. So.
Well, I am so happy I met you, and I'm learning all about the great things you've done. Now, I heard you've come from a family of doctors from Iran. And
Yes,
I was told to ask you to share briefly about your father. He did something phenomenal before we get to COVID-19.
Yes, that's right. My father is called father of nature in Iran. He was an environmentalist. He was an obstetrician gynecologist, and he had the first private hospital in a very remote place where there was very deprived area where there was no consultant, no specialist. And he set up his own hospital there, and he helped. And then, of course, he was the only one for kilometers and miles. He was very successful, and he was very helpful to the people, so they loved him. And then gradually he changed from medicine to the nature. And he says it is not enough to treat people. You have to protect nature in order to treat the diseases. So he then became a vegan, and then he gave all his assets, which was plenty, because he worked very hard all his life, to a trust to cultivate the trees and look after nature and education for less privileged people. So he has had a lot of things in the city he worked. He has a lot of parks under his name, a school on his name, and he gave all the lands, everything. And fortunately, at the present, my sister and her husband are trying to continue his work, as well as I help from us from London to carry on his aims in life, which is environmental.
That is wonderful. I take it he's no longer with us.
No, unfortunately he died last year. He had a stroke at the age of 82, and he lasted 4 years. And then last August he passed away. And it was a big ceremony and everything from everybody, because they loved him, and he was called Father of Nature of Iran.
Wow, thank you for sharing that little bit of family history with us. I am sure that if he were alive, he'd be happy now, because all the humans have been forced indoors and the planet is allowed to breathe and flourish. So I'm sure wherever he is, he's smiling down going, good, my earth is getting a chance to rebuild and reboot.
That's right.
Well, thank you again for sharing that with us. And I was going to ask you, what can you tell us about COVID-19? How is it affecting you at work and your personal life?
As I told you, I was doing mainly gynecology in the hospital as well as privately, and I'm very busy both sides, because we had this new project and everything, and I was trying to get some projects working as laser treatment for women who have breast cancer and they cannot use hormone. So all of this was working on alongside on the NHS, National Health Service, and private. When the first lockdown happened, which was the end of March, about 4 weeks ago here, and then all our elective work in gynecology has stopped. So, for example, I had a couple of clinics every week, and we had one session of operating,
Okay.
one outpatient, everything elective, which was not cancer, was stopped. And this was mainly because we wanted to have the theaters ready for the COVID patients. And obstetrics carried on because we're still having babies and still need to come and see us. So we carried on seeing, but mainly in the virtual matter. So we called them and arranged for the scan and blood test and everything to be done at the same time. And I go and see them as well. So it was one time they come to hospital and the partner couldn't come. They have stopped now. The partners coming for the appointment, but not for the scan, and not for the delivery. For a scan, they cannot come. For appointment, they cannot come, the partners. But the gynecology all stopped except the cancer. And cancer is trying to be moved to the private hospital where they are COVID-free theaters. Because we are now using all the ITU beds and because for example, if you think a big hospital where we have got 12 theaters and 12 anesthetic rooms, and this is not like 20 ITU beds. That's different. ITU beds are different. But we are now using the theaters and anesthetic room because they have all ventilator as well. So we are using that. And then the next door hospital, which is one of the biggest heart hospital, they were using that as well, 12 cardiac theater. So all of this, they didn't want us to do a difficult gynecological procedure in case you need to use one of those ventilators. If it's cancer, even there is now a little bit, delay, but gynecology, benign gynecology, which is not cancer, we are only doing emergency, and that's not very often. So we just sit down and cover labor ward and cover emergency, but we don't do any elective work.
And are all of those beds full with COVID patients?
And we thought, we are very close to Nightingale Hospital. You know, there is called Excel Center in East London, which is 5,000 bed hospital in 9 days was made. Yeah, the army and everybody went in there and they made the hospital, which is called Nightingale, 5,000 bed, and they were supposed to take all the patients who need ventilation there. However, staffing it has been difficult. because we do have enough doctors, because we are, a lot of us are free, we are not doing elective work, but the problem is the critical care nurses. We don't have enough, and half of them are all in isolation. So the difficulty.
Nurses?
Yeah, critical care nurses are special. Yes, they are higher than normal nurses.
Right.
They normally in ITU 1-to-1 with the patients. Yeah, but now they have to do like one in looking after two, and the patients are very unwell. And I heard from my colleague that they have to change the position of the patient who is ventilated a couple of times a day, at least every few hours, because in that way the lung can push up the fluid which is activated there. And that needs, like, I never went to ITU because there is no point going there, but I could see the photos when 10 people trying to move one person to put prone and then back again. It's impossible. It's very, very difficult situation for the doctors and for the nurses. And there are not enough critical care nurses in ITU nurses. And that's the only problem, that it's stopped Nightingale working. And even they made another hospital in Birmingham, I think. And that one is not open as yet, because they said we can actually, by closure of the other elective work, we managed to get the beds free for the COVID patients. So even in our hospital, there are a couple of beds left still, So it's not, you're not that inundated that we need to rely on Nightingale at the present.
What's your death rate like at the hospital to date?
At the, we just heard from England. It was 600 and I think 69, but it's been like that between 600 and 700 for last few days.
And this is just in your hospital, or is this general for England?
Yes.
Okay.
Yes.
Okay.
For UK, and then we know that the hotspot is London, and that's because of multinational and because of diversity of people, because there are businesses, factories, businessmen, they are traveling. So it is a high. The only thing which we have noted in England, which is sad, that the majority of the people, of the health workers, like doctors, nurses, social workers, and social carers, and all that, they were about probably around 60% were from ethnic minorities.
Oh.
And there is a discussion that maybe it's related to their comorbidity, the background, that they have diabetes or high blood pressure or different things, but they are looking into it and they want to find out what it is.
So are these older patients then? Are these patients older?
No, there are, majority of them are older, majority of them have got comorbidity, but there are young doctors and young nurses and a couple of also pregnant women.
Okay.
Whom they have younger, and they actually delivered, the baby survived, but there was one midwife who died.
Oh, I'm so sorry. Just based on what I am gathering from doing these interviews around the world, it sounds like places where people use public transportation, where people are jammed into trains and buses. It seems like they've had a wider spread in those areas.
That's right. The lockdown was because of that, and they are saying that please do not use the public transport, because these are mainly for the people who are using it. So the health workers, they need to use it securely and safely. That's why they are saying that please do not move. And in England, the lockdown is not as strict as France, where you need a piece of paper. Mm-hmm. You can go once out for your exercise, you can go once out for your shopping, and if you go to work, then you can go to work anyway if you're sort of in medical health worker. But it's not that they let you go to the park, but you cannot sit down and have it. And the shops are closed. Only the shops which have essential things, then you can go and buy.
It's very sad. It's so bizarre when you really think about it, and how suddenly the entire world is being affected by this infamous virus that we can't even see. We see pictures of its structure, but this invisible thing is just ravishing the world and taking down pretty much everything in its sight and its reach. I interviewed someone this morning in Italy, in Milan, and he told me their government told them that this virus was only attacking older people. And it attacked the cardiovascular system, not the respiratory system. And he thinks it's because of this misinformation that their death toll is what it is. Do you feel that in England it has plateaued, or do you still see the numbers escalating?
No, I think it's, I can see from the last few days, it has plateaued. But what the problem is, what the discussion is, okay, we are now locked down. You assume that we release this lockdown and everybody goes out, and the tubes and the public transport is overloaded and everybody is going out, then you will have another peak, no? And
exactly.
This is worse than what we have got now, because now the plateau is because we don't see each other, we don't get it from the other people. And then the people who are in the hospital, we are now having apron, glove, goggles, and also mask, surgical mask. But before it wasn't that. And then now they are saying in outside as well, if you can make your own mask, it's good. Although because I think there is it's a shortage of surgical masks. They don't want the people to use it. And then when it comes to health worker, then there wouldn't be enough. But I know many hospitals, when they go into the hospital, the people at the entrance, they give them mask, and they check the temperature, all these sort of things. But I don't think there is any yet a guideline that everybody should wear a mask outside. So majority of the people are not, when they're walking in the park, they actually make sure that they'll be 2 meters away from each other if they haven't been living together, but not necessarily the mask.
That's interesting that it's not mandatory there, because yesterday I went shopping and a gentleman, everyone in the store had masks on and I didn't. And this man came up to me and says, "Ma'am, do you know that starting next week, if you're not wearing a face mask, you're going to be fined up to $1,000? So that's going to happen here in California. So I'm surprised. And I laughed.
That's what we are expecting, because many countries around the world, they are saying it's obligatory to use the mask. Yes, but in England, I think they think about it first before making mandatory, because if they are going to buy all the masks and then there is not, I just don't know really.
Let me ask you this question. As a physician, I don't want to cut you off, but I think it's important I ask you this, because people have been asking me to ask this question.
Yeah.
Does the mask really help? Or do the masks help?
What I had discussion from infectious control doctors,
yeah.
Not one of them, it's mainly the droplet. It's your own droplet. If you are going to give it to somebody else, you are reducing by 30, 1 in 30. That's good for the other person who's in front of you.
Right.
You're actually protecting the other person.
Right.
But from there to us is less. But if she has the mask and I have the mask, then it would be much better.
Right.
But you couldn't say. And also the other factor where we were saying that This is aerosol, and it is by touching, yes, and touching that person, and then touch your mucosa, the nose, mouth, or the eyes, you will get it. So it's not only from droplet, which is from droplet to you, which may go a few meters.
Right.
If you, that would be controlled, but also from touching, from the there is all these, I don't know whether it's evidence-based or not, whether they stay 72 hours on the surfaces, all these sort of, they say that, but I don't know. I know in Singapore, between the patients, you change your gloves. In this hospital as well, we do change the gloves. Don't change the mask, just change the apron, glove, and the goggle and mask would stay, and then surfaces would be cleaned with the between the patients.
Can you believe we're almost out of time? You've been so informative. Before we go, one more question someone told me to ask. If you have the virus on one part of your body, can the virus move from that location to another part on your body on its own? Do you know the answer to that?
I think that's how it affects. You will get it in your mucosa. You go into your breathing,
Your lungs.
Your lungs, and then it goes to trachea. I was looking for trachea, and then it gets to the lungs. It affects the lungs, and then what you mentioned before as well. There is a theory that it actually damages the lung somehow. That the body produces antibody against the lung cells. So there is immunity, some allergic reaction. When something goes into if you're allergic to peanuts and you eat peanuts, what happens? There is an allergic reaction. The body says to you that you have got something nasty. We have to kill that nasty thing.
Right.
And then you're actually killing the person rather than trying to kill it. That's one theory. The other theory is that the young people, they get that in their heart. So they get cardiomyopathy and damage to the heart. And then there is another theory that this virus causes the clotting of the body changes, that they have microemboli or a small little clots in the vessels. It's like, have you heard of pulmonary embolism?
Yes.
But very small little ones all over. Then you cannot, your heart stops, because your heart is pumping the blood into your lung. Your lung is blocked with these emboli, then the heart stops working. So these are all theories how this virus kills the young, the old, and the people who are not well. These are the theories. I don't know. It probably in future it will all come.
Okay, and I always ask everyone this question, and I have to ask you as well. What have you learned from this virus? For you, about you. What have you learned about yourself going through this pandemic?
I think I learned that the life is short, shorter than you think, and it could be much shorter as well. And you have to look after nature. So once again, what my father said comes to our view, that we should keep this air for our kids. We should look after. We shouldn't use it. We shouldn't abuse it. All these things that a little bit more philosophical. I probably learned that, you have got not that much long to try to make a change.
That's great. What will you change about the way you did? Because what are you going to change that you used to do because of this experience, if anything?
I think probably I concentrate more on these philanthropist issues and environmental issues, and work less towards the elective and routine work, and sort of make money. So
I
spend it.
No, I agree with you. I just never understand this pressure people put on themselves to make money. thing, I always remember Steve Jobs. I read his book, and I
Yeah.
remember him saying he spent his whole life trying to make so much money. And all he did was work, 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 you know, and then he found himself in a place where the money could do nothing for him. The time was gone. The essence of what he was saying, what I got from it, the time had passed. It was too late. He couldn't get the time back. Here was the money. So
Exactly.
I think that we have to have balance. We have to get money because we have to pay bills, but there's so many other things that I think is required of us in our lifetime.
Yes, and make a change.
Yes, and then try to find balance, you know, work and make money, but have fun or enjoy your life. And for me, my goal is to leave a legacy of the change that I want to see in the world.
Exactly same for me, and my sort of following the footstep of my father, because there is a proverb in Persian. It says, "Gharaz nakhshiz kaz ma baz manad." It's the thing which the legacy that stays from us, not you just work and work and work and nothing remains. And what it remains is what you have achieved in life.
Exactly.
That's
No, you've been so informative. I've really enjoyed doing this interview with you. Do you visit your home country often? Iran?
Yes, very often. And we have got my father's foundation, which is called Shohreh Beski, which is a mainly environmental and foundation. And I go and teach there, and I go to the congresses in Tehran and teach the doctors there and new techniques, everything. I go 2 or 3 times. I take my kids, my grandchildren, all of them to Iran. Yeah, we go on holiday.
That's really wonderful. Now, I've been asking you many questions, but I always ask this too before I wrap up, just in case I haven't asked you a question that leads to something pertinent that you want to leave with my viewers. What would you like to leave with them that I didn't ask you, if anything?
Which you didn't ask me.
Or is there anything you want to leave that we haven't discussed?
Not really, except what I would say, that if you have an idea that looks very not easy achievable, then do not lose the sight of it and try to do it against all the odds. And you will be successful if you put your passion and life into it.
That's great. Thank you so much. I really, really appreciate this time. And I think we should stay in touch. I'd like to do an interview with you and the vagina research you're doing.
Are you going to remove that part? Yes, I hope so.
No, when it's proven, because I know you're doing the trials now.
It's not actually, because they don't let anybody to do the trial unless you have got evidence.
Oh, I see.
And it's not possible. So you just have to do it and say to the patient that it's not going to harm you, but it may not help. So it is not a randomized trial, because the people have to pay for this new technique.
Oh, they have to pay for it.
Yes, it's not NHS. No, it's not available. And NHS wants evidence before they introduce into national health. Then it's all a vicious circle. You don't have evidence, they don't let you do it, then you never get evidence. So you just have to say, let me do it, and I'll show you the evidence, then we'll, with limited evidence, yeah.
Well, thank you for all the hard work, all of the hard work that you do to help other people. I think all doctors, nurses, everyone in the service industry needs to be commended, because you are working hard and giving of yourself to make life better for other people, and that's remarkable.
And you know, every Thursday, in England at 8 p.m., all the people come for 5 minutes and they clap for the health worker.
Well, you guys deserve it.
Yeah,
So,
all of us who work in the industry.
Thank you so much. So you please stay safe, take care of yourself and your family, and we will be in touch. Thank you so much for watching Conversations with Jennylyn. When a conversation is all you need to be inspired, like this one. Thank you so much.